My name is Caitlin Butler. I'm an RN student at UACCB Batesville, and I will be performing this physical assessment for the program. I was explained that during this procedure, at times I will have to apply touch, and you shouldn't feel any pain. I provided us with privacy, and I performed hand hygiene. I allowed you to go to the bathroom, and while you walked to the bathroom, I assessed your gait and your balance. You were well balanced, and your gait was even. There were no irregular movements. I assessed your height and your weight. They were proportionate to each other. I assessed your vital signs. They were within normal limits. We did the smell and eye chart. You tested 20/20 without corrective lenses, so cranial nerve 2 optic is intact. So can you tell me your name?
Sharitha,
Can you tell me the date?
February 15th, 2017,
Can you tell me where we are?
Conway, Arkansas.
Client is awake and orientated ×3. You're positioned in your body posture. You're erect yet relaxed with your shoulders. Your arms are crossed. You're facing your mood and effect say that you're content, you're relaxed, you're comfortable. Okay, so now I'm going to assess your hair and your scalp. Your hair is evenly distributed. Your scalp is clean, free from nits. There's no discoloration. I'm going to palpate for tenderness, nodules, masses, and thickness. There's no thickness, no masses. Okay. Now I'm going to assess your face and your head. Your head and your face are proportionate to your body. Your eyes are symmetric, your ears are symmetric, your nose is in the middle of your face. Your lips are nice and moist. I'm going to assess your eyes. Your eyelashes are evenly distributed. Your sclera is white. Your conjunctiva is clear. I'm going to palpate your lacrimal ducts for swelling. And there's no swelling, okay? I'm going to palpate your sinuses. You might feel pressure, but you shouldn't feel any pain. Okay. I'm going to do the rest of the cranial nerves right now. We've done cranial nerve 2 optic with the eye. So now we're going to do cranial nerve 1 olfactory. I'm going to ask you to close your eyes, and with one finger you're going to close the nostril and you're going to take a smell, and then we're going to do the other side. Okay? Okay. Apple. Bubblegum. Apple and bubblegum are correct. Cranial nerve 1 olfactory is intact. Now we're going to try for cranial nerve 3, 4, and 6. That is ocular motor, trochlear, and abducens. What I'm going to ask you to do is to follow my pen light without moving your head. Okay. Can you look at that back wall for me? Okay. Okay. And come from the side. Okay. Come from the side. Okay, I'm going to look at your eye again. Okay. Your pupils are equal, round, reactive to light, accommodating. They constricted from a 4 millimeter to a 2 millimeter. You moved and followed the cardinal fields of gaze without moving your head, and you didn't have any irregular eye jerking movements. So cranial nerve 3, 4, and 6, ocular motor, trochlear, and abducens is intact. Now I'm going to try for cranial nerve 5, trigeminal.
Forehead, left cheek, chin, right cheek, nose.
Cranial nerve 5, trigeminal is intact. Now we're going to do cranial nerve 7, facial. Can you smile, frown, scrunch your face up? Okay, I'm going to look in your mouth for saliva. There's adequate saliva. Cranial nerve 7, facial is intact. Cranial nerve 8 is acoustic. I'm going to push your tragus in and out while whispering a 2-syllable word into the ear, and then we're going to do the next ear.
Sunday. Football.
Sunday and football were the two words, and you got them correct. So cranial nerve 8, acoustic, is intact. Cranial nerve 9 and 10, glossopharyngeal and vagus. Can you swallow? Okay. I'm gonna look inside your mouth. There's no inflammation, okay? And with the cranial nerve 10, the vagus, I would take a tongue blade and stick it to the back of your throat and induce your gag reflex. I'm not going to do that. So cranial nerve 9 and 10, glossopharyngeal, and vagus are intact. Cranial nerve 11 is spinal accessory. I'm going to assess your trapezius with my hands. So can you push up against my hands? Good. Cranial nerve 11, spinal accessory, is intact. Cranial nerve 12 is the hypoglossal. Can you stick your tongue out? Good. There's no irregular movements, no deviation. So cranial nerve 12, hypoglossal, is intact. So now I'm going to assess your neck. So can you just lean back for me for a second? It's symmetric. Your trachea and your esophagus are in the midline. Okay, can you take another drink of your drink for me? I'm going to see if I can palpate the thyroid. Can you take one more? Your thyroid is non-palpable. Okay, can you lean forward? Can you lean back? Can you side? Can you to the side? Okay, the range of motion of your neck is good. There was no pain or tenderness doing that. Alrighty, now I've looked at your eyes. Your eyelashes are evenly distributed. There's no inflammation or draining. I'm going to look at the nose. Your external nose, there's no discoloration. There's no drainage present. Can you lean back so I can look inside the nose? There's no drainage, no lesions. There's no septal deviation. Your turbinates are pink. Your inferior and your middle are present or visible on both sides. Okay, I'm going to put some gloves on so that I can assess your mouth. Okay, I've got a nice unopened gauze pad here for when we get to that part. Okay, can you open your mouth? Oh, there we go. The saliva is adequate. Your buccal mucosa is pink and moist. Pink and moist. Your hard palate is white with irregular rugae. Your soft palate is pink and moist. Your uvula rises and falls to the midline. There's no lesions. Your teeth are straight, they're white, there's no dental caries or malocclusions. Okay, gonna open this. Sorry, go ahead. Okay, I'm gonna palpate your tongue for nodules. There are none. Okay, your lips are moist. There's no lesions there on the buccal mucosa. Okay. Done with that. Put this away and I'm going to perform hand hygiene again. Okay. Alrighty. So now we're going to assess your anterior and posterior chest. I'm going to inspect the curvature and the shape of your chest. Okay. I'm going to assess your ear. I forgot to do that while I was doing your head. Okay. Tell me if there's any pain or tenderness as I feel the auricle for nodules or masses. No? What about the tragus?
No.
No. Tragus? Okay. Your ears are proportionate and symmetrical. We assessed earlier for what size would fit you for the otoscope. So Turn that on. Okay. I'm going to pull your pen up and back. There's no drainage. There's no inflammation or redness. Your tympanic membrane is pearly gray. Your cone of light is at 7 o'clock. Your manubrium, umbo, and short process are directly above there. Okay, I'm going to check the other ear. Okay. Your tympanic membrane is pearly gray. I found your cone of light. Your manubrium. There's the umbo and the short process. There's no inflammation or redness. There's no drainage in this ear either. Okay. Okay. Now back to the anterior and posterior chest. Okay, I've inspected it. They're round. Okay. I'm going to touch you and have you breathe in and out, and I'm going to feel for chest expansion. Okay, I'm going to do the back. Your chest are expanding. I'm going to check for tactile firmitis. I'm going to touch you in various places, and I'm going to ask you to say 99. Okay?
99, 99, 99, 99, 99.
Okay. I would do the same for the back. Now I'm going to feel the carotid artery one at a time. One plus. One plus. Okay. Now I would listen to the carotid artery for bruits. Warm that up. Okay. Okay. There are bronchial sounds over the larynx and the trachea. There's bronchovesicular sounds over the main bronchi, and then there's vesicular sounds over the main lung fields. Now I'm going to percuss your chest for resonance. Okay, there's resonance throughout. Okay, I will do the same for the back, and now I'm going to listen to the lung sounds. Lift up here. Lift up here. Okay, I did that to, I also tated the lung sounds on the anterior chest. I would also take the lung sounds on the posterior chest. There would be bronchial sounds over the neck. There would be bronchovesicular sounds over the main bronchioles, and there would be vesicular sounds over the lung fields. So now I'm going to listen to your heart and all the different, I'm going to verbalize the locations that I'm listening to with the bell. Aortic, pulmonic, herbs. I'm going to lift up here. Tricuspid. And mitral. Okay. Listen to your chest. I'm going to palpate the precordium for thrill. Precordium for thrill. Okay. Then I'm going to palpate your PMI. It's the fifth intercostal space, mid-clavicular line. So let me find that. Okay. Okay. While I'm here, I'm going to compare the apical pulse to the radial pulse for deficit. Okay, let me find the apical pulse. I'm going to compare it to your radial pulse. Okay. I'm also going to verbalize that as I listen to your heart sounds with the bell, I would have you lay on your left lateral side. I would have you sit up to spine, bending forward and backwards, and I would listen to the heart sounds for murmurs with the diaphragm of the stethoscope, as well as laying on your left lateral side. But we're not going to do that. Okay? I've inspected your chest. You listen to your lung sounds. I've listened to your heart. Now I'm going to inspect the contour of your abdomen before I have you lay back and do that. Okay? So the abdomen. Okay. It's rounded. Okay. I'm gonna also feel your chest for your heart for heaves. Okay. Your abdomen is rounded, so I'm gonna ask you to lay back now so I can do your abdominal assessment. Okay, I'm gonna lift your shirt up and expose your stomach, okay? Okay. I'm inspecting it for discoloration, striae, veins, and bulging, dimpling. There's striae, but she explained to me earlier that she's had 2 children. Okay, no veins, no bulges though. Okay. I'm going to also take your stomach now, all 4 quadrants for bowel sounds. Okay. I'm going to start in the right lower, then right upper, then left lower. I'm listening for general tympany throughout. Low gurgles and clicks. Low gurgles and clicks. Low gurgles and clicks. Low gurgles and clicks. While I'm here, I'm also gonna take your aorta, your renal, your iliac, and your femoral arteries, okay? The aorta, renal, come right here for your iliac, femoral. Now I'm going to palpate your abdomen. I'm going to palpate 3 areas in each quadrant. No tenderness. Okay. I'm going to palpate with light touch. And I'm going to palpate with deep touch. I'm going to try to palpate your liver and your spleen. Now your kidneys. Thank you. Your liver, your spleen, and your kidneys are non-palpable. Okay, you can sit up for me and I'll cover you back up. Okay? We did the chest, but we're going to talk about the breasts now. Can you put your hands on your hips and no dimpling, no bulges, hands above your head? No dimpling, no bulges. Okay. Now, breast exams, you do them every month. You want to do them at the same time every month. So the easiest time to remember that is the first day of every month. You're going to, you can do it in the shower when you're nice and soaked up so that your hands can glide over it better because you want to touch the whole breast. Okay? So use the ball of your hand and you want to go over the entire breast in a systemic manner. Yeah, the whole breast. There you go. And you're looking for any lumps, knots, nodules, tenderness, anything that's different from what you know the normal is. And you want to do both of them. Ball of your hand. Like I said, it's easier to do this in the shower. You're all soaked up and you're already in there. Okay, then you want to take your forefinger and your thumb and compress your nipple to assess for any drainage. Okay, you want to do this the first day of every month. So there's your breast exam. Okay, now we're going to do range of motion of the arms, the upper extremities. So for your range of motion, can you lift them up, take them down, can you spread them out, backwards, forward, there you go. Can you flex your arms, extend your arms, flex and extend your wrist, circumflex your thumbs, move your fingers. We're good. Okay, I'm going to assess your joints for crepitus now. So can you spread your arms? There we go. And up. Okay. Can you flex and extend your elbow? Okay. Flex and extend your wrist. Okay. Check the fingers. Okay. Okay, no crepitus in that arm. Do this one. Okay. Okay. Okay, and your fingers. No crepitus in that arm or your hands or fingers. Now I'm going to assess your arm strength. I'm going to hold your arms out and push against my hands. Okay? Can you push up against my hands? Okay? Can you squeeze my hand for your hand grips? Okay? And I want you to stick your arms out with your palms up. No palmar drift. Okay? And now I'm going to assess your peripheral pulses. So I'm going to do them at the same time to make sure they're equal and bilaterally. Okay, your radial pulse, They're bounding. I'm gonna give them a 2+. Your ulnar pulse. It's bounding. I'm gonna give it a 2+. Your brachial. Find that one. Okay. Give that one a 2+. And then your temporal. 2+. While I'm here, I'm gonna go ahead and see if I can palpate your lymph nodes. So we've got pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, pre-cervical, post-cervical, deep cervical chain, and can you go like this? Thank you. Supraclavicular. All are non-palpable, okay? Now we're going to assess your lower extremities. So I'm going to try to find your peripheral pulses down here. Okay. Your popliteal behind the knee. Okay. Your posterior tibialis. Equal bilaterally. Your popliteal was bounding at a 2+. Your posterior tibialis bounding at a 2+, and your dorsalis pedis. Let's see. At a 2+, equal bilaterally. Okay, I'm going to ask you to push your feet against my hands. Okay, I'm going to ask you to, I'm going to squeeze your legs together and you try to separate them against my hands. Okay. Now, I'm going to ask you to extend and flex your leg. Okay, now I'm going to do it and check your joint for crepitus. No crepitus. Can you flex and dorsiflex your foot? No crepitus. Do this one. Extend and flex your knee. No crepitus. Your foot. No crepitus. Okay. I'm going to assess your reflexes now, because you just did the range of motion. Could you stand up for me so we can do the range of motion of your hip? Can you abduct and adduct your hip? There we go. Another one. Okay, you can sit down so I can check your deep tendon reflexes. We're going to check the brachial reflex. Can you bend it? Can you flex your arm for me? There we go. I found it. Okay. Okay, that was really good. I'm going to give that a 2+. Okay, can you flex your arm one more time? Okay, found it. You can give that one a 2+ too. Okay, can you kind of hang your arm for me? A 2+. Now your wrist. Because we did the bicep and the tricep. Now we're going to do the brachial radialis one. A 2+. Okay. There we go. I'm going to do your popliteal, patellar. Popliteal is the artery. Go ahead. Okay. 2 plus. Okay. Sorry. Did I get that word? Sorry. Your Achilles. Okay. And now I'm going to check to see if your toes fan. They do not. Sorry, it tickles. Okay, your toes do not fan. It tickles. Okay, I've done your peripheral pulses. Okay, can you stand up now? I'm going to ask you to walk down there and with your heel to toe. Okay, now walk back heel to toe. Okay, I'm going to ask you to turn and face that way. I'm going to check the concavity of your spine. Okay, I'm going to check your cervical concavity, your thoracic concavity, and your lumbar concavity. Can you bend forward so I can check for scoliotic deviation? There are no deviations. Okay. Can you bend forward? Can you bend backwards? Can you lean from side to side? Range of motion of your neck. Your back. Okay. You can sit down now. Okay. Can you pat your legs with your hands? Crisscross. Okay. Can you touch your nose and then touch my finger? Can you touch your nose and then touch my finger? Can you touch my finger? Okay. Can you stand up with your hands to your side? There's no swaying, no rocking back and forth. Can you do it with your eyes closed? No swaying, no rocking back and forth. Can you keep your eyes closed and touch your nose with each finger? Okay. And can you make your heel touch your shin? Okay. You can sit down now. Okay. I'm going to touch you with 2 things, and you're to tell me the difference between sharp and dull pain. This is the sharp. This is the dull. Okay? Close your eyes.
Sharp. Dull. Sharp. Dull.
Okay, keep your eyes closed. I'm going to see if you can assess light touch.
Yes. Right leg. Right arm. Left arm. Right arm.
Okay, and can you tell me 2-point discrimination? So tell me the 2 places that I'm touching.
Knee, right knee, left eye.
Okay.
Left shoulder, left knee.
Okay. I'm done. You can open your eyes now. Okay. Can you... Oh, goodness. Oh, verbalizing the female genitalia. So you would inspect and assess the pubic hair distribution and evenness, cleanliness, that sort of thing. Then you would inspect the labia majora and minora. You would inspect the you would inspect the labia majora and minora for nodules, masses, discoloration. You would inspect for discharge. You would inspect the urethral opening for inflammation, that kind of thing. And you would inspect your rectum for hemorrhoids. On the male genitalia, you would inspect and assess the pubic hair for distribution and cleanliness. You would inspect the penis. You would palpate the penis for nodules, lumps, masses. You would inspect it for discoloration. You would also inspect the scrotum. You would palpate the penis. You would palpate the scrotum for lumps, nodules, tenderness, masses. You would palpate the inguinal opening from under the scrotum, following the path to the inguinal opening. You would inspect the rectum for hemorrhoids. And then you would I think that's all to my physical assessment.